Good morning. So today I thought I would talk to you about mental health and the dangers of mixing illicit drugs and previously held mental health conditions. So maybe depression or anxiety or bipolar, borderline personality disorder, just to name a few, are some previously existing conditions that you might have, or a person might have rather, and these conditions can be affected by illicit drugs and alcohol use. So I have been doing some research, and I have an article from the American Addiction Center that I've decided to read to you. So I can describe psychosis and some potential treatments for this disorder. So, okay, so I guess I'll just start reading. It says, anytime symptoms appear when taking prescription medication, that individual or a loved one should contact a doctor immediately. It may be necessary to immediately stop taking the medication altogether. Psychosis can also become more likely when these medications are abused. When it comes to non-prescription intoxicants, the likelihood of psychotic symptoms appearing and what that looks like varies from substance to substance. For example, a large amount of cocaine all at once can cause psychosis in minutes. Psychosis from cocaine or amphetamine use typically produces persecutory delusions. So I had several experiences actually with psychosis and delusions after using narcotics before I quit. So I have been in recovery just a little over a year. And I did that with the help of the Nova Scotia Mental Hospital and the psychiatrist involved. With a little help, people with alcohol and drug addictions can quit, but they do need a little help. Hallucinogens can of course cause visual, auditory, and tactile hallucinations, but this is not the same as psychosis. However, an adverse reaction or taking too much of this kind of drug can also cause delusions and paranoia. Once the individual is no longer aware that the hallucinations are not real, that's when you have a break from reality and a serious problem. So I had an experience where I honestly believed I was a clone, and that actually caused me to become quite agitated and violent, and I thought I was on trial at some point even, and I wasn't. So certainly this article is true. I'm going to ignore the area covered for treatment section because this is an American article and I am a Canadian, so that would be different. Substance-induced psychosis, signs, symptoms, and treatment. So according to the National Alliance of Mental Illness, psychosis refers to an episode in which an individual has a break from reality. This often includes, but does not require, delusions or false beliefs that are firmly held despite clear evidence to the contrary and hallucinations. About 3 in every 100 people will experience at least one episode of psychosis in their lifetime. That's actually quite a bit when you think about it. Drug-induced psychosis, also known as substance-induced psychosis disorder, is simply any psychotic episode that is related to the abuse of an intoxicant. This can occur from taking too much of a certain drug, having an adverse reaction after mixing the substance, during withdrawal from a drug, or if the individual has underlying mental health disorder issues. Though it's not actually true that taking a certain kind of drug can suddenly trigger a severe mental illness where none had existed, mental illness is a predicator of substance abuse, and someone prone to psychosis can be triggered by becoming overly intoxicated. Okay, so what I learned during my treatment that I hadn't previously known is, I had understood that narcotics can alter your perception of reality, but what I hadn't realized is that excessive amounts of alcohol can also cause psychosis. So at some point, I had treated the drug addiction part, but still was struggling with alcohol addiction. And what happened was that I didn't get better because I was still drinking excessive amounts of alcohol. Substance abuse is defined as the use of any illicit intoxicant, any use of prescription medication outside the direction of doctor, or excessive use of substances such as alcohol. According to the Substance Abuse and Mental Health Service Administration, SAMHSAS, National Survey on Drug Use helped 9.3 of individuals in the U.S. and 12 older needed treatment for drug or alcohol problem in 2009. This is not including people who occasionally abuse drugs but are not considered to have dependency issues. This amounts to 23.5 million people. Okay, that's quite a bit. Alcohol abuse can cause psychosis, but typically only after days or weeks of intense use. People who have chronic alcohol abuse problems that has lasted for several years are also vulnerable to intense paranoia and hallucinations. This occurs due to the damaging effects of alcohol on the brain over time and due to a lack of thiamine, a vitamin B complex, in the body that can lead to Wernicke syndrome. So WERNICKEKORSAKOFF syndrome. Substance abuse does not always lead to physical addiction, but it does increase the risk of developing this problem. The longer and the more intense the abuse, the greater the risk. Physical addiction is characterized by the emergence of withdrawal symptoms when the individual stops taking the intoxicant in question. Depending on the type of substance abuse, the length of time the abuse has gone on, and how much is typically taken at once, withdrawal can include psychosis. The most commonly known symptom in substance-induced psychosis from withdrawal involves alcohol. Long-term alcohol addiction can significantly change the chemistry and even structure of the brain, possibly producing a set of symptoms referring to delirium tremens when the addicted individual stops consumption. Okay, so I didn't know that either. And I don't think that was reviewed during my treatment. But I certainly, looking back, can relate to the fact that when I was going through withdrawals, and sometimes those withdrawals would include seizures, as well as I did suffer delusions at the same time, but I didn't think they were delusions. To me, it was real, and everybody else was in another world. Symptoms of delirium tremens include agitation, excitement, irritability, confusion, disorientation, delirium, sudden mood changes, fatigue or stupor, restlessness, body tremors, changes in mental functions, decreased attention span, sensitivity to light, sound, or touch, seizures, and hallucinations. Delirium tremens is considered to be a medical emergency. The psychotic symptoms can be severe and require sedation, while the seizures can be directly life-threatening. Psychosis can also appear during withdrawal in any individual who suffered long-term addiction to many substances that significantly affect brain chemistry. This includes amphetamines, opiates, inhalants. These symptoms can last for hours or days, and it's likely that the individual will need to be sedated for at least closely monitored during this period. When it comes to methamphetamine, psychosis can spontaneously reappear in people who have been clean from the drug for many years. Psychosis and mental illness. There are a number of mental illnesses that include psychotic episodes, symptoms such as schizophrenia. It's often the first illness that comes to mind when people think of psychosis. However, not every type of schizophrenia includes psychotic symptoms. Paranoid schizophrenia is characterized by hallucinations and delusions, though how disruptive this depends on the severity of the condition. People with bipolar disorder can experience psychosis. This typically occurs during severe manic periods. Psychosis can also appear in people with major depressive disorder, which can result in diagnosis of psychotic depression. Unfortunately, this disorder has a high mortality rate due to the intense suffering combined with psychotic episodes. Other disorders that have psychosis and symptoms include delusional disorder and schizoaffective disorder. Plus, it can present in degenerative brain diseases like Parkinson's, Hutchinson's, and dementia. Brain tumors, cysts, or unwanted HIV or syphilis can also cause psychosis. When an individual has mental illness that already had the potential to include psychosis, drug abuse can more easily lead to this symptom. It can be tricky to determine whether the drug abuse triggered the psychosis or whether the early effects of psychosis led to drug abuse. At the same time, certain substances can interact with antipsychotic medication, causing them to become less effective or ineffective, triggering a psychotic episode. Another difficulty in the spiraling nature of the drug that triggers psychosis due to the fact that psychosis is such a disruptive event that can cause so many problems. Individuals dealing with one of these mental illnesses may turn back to substances to cope. This is a common problem with people who suffer from severe mental illness that are more difficult to treat and standard mood disorders. Plus, especially in people with schizophrenia and major depressive disorder, self-care can be incredibly difficult. With bipolar disorder, manic depression can come with reduced impulse control. This can result in excessive compulsion of drugs or alcohol. Consumption of stimulants make the mania worse, and the spiral can eventually result in psychosis. On the other side of the spectrum, bipolar patients in depressive state may turn to alcohol or stimulants to self-medicate. Substance-induced psychosis treatment options. So the treatment options, let's see what they say. Psychosis is merely a symptom, not a condition. in and of itself. It's typically very temporary, resolving in a couple hours or days at most. However, very serious symptoms that often require emergency medical treatment intervention. Okay, so in my case, I spent 2 months in the hospital, so that's definitely over the 2 days or a week that you might think typically somebody might experience psychosis. So for me, medical intervention was necessary because I had become violent and so delusional that I was a threat to myself and others. But I wasn't getting the proper treatment. I was getting some medical treatment for my other previously existing mental health condition, but I wasn't able to get drug and alcohol treatment for addiction due to Canada's messed up healthcare system at the moment, where it is free, and that is great if you can get a doctor. However, you can't always get a doctor. Alarming psychosis statistics. 1 in 5 people with a history of psychosis will attempt suicide. And I have previously, many times actually, attempted suicide, especially in my youth, when my mental health condition was much more severe. In the case of substance-induced psychosis, the obvious cure is to stop abusing any substance. However, the reality is often more complicated. Addiction can make it difficult to stop, and withdrawal symptoms are virtually unavoidable after long-term substance abuse. Mental illness symptoms can become unbearable to the point that affecting individuals self-medicate, or a loss of impulse control can blow any resolve to abstain. The answer to substance-induced psychosis is an effective treatment. There are plenty of options for drug and alcohol addiction treatment. Medically supervised detox can easily prevent the more severe symptoms of psychosis through the use of common medications or by tapering off the substance rather than quitting cold turkey. Once the initial detoxification is complete, psychosis should not be an issue. However, relapse and subsequent necessity for another detox can increase the chances that psychosis will appear as a symptom during withdrawal. Because of this, it's important to follow detox with a complete rehabilitation program. This can be set at an inpatient facility or outpatient. Both types of care should involve therapy or support group meetings to learn the necessary skills to live a certain life. After several weeks of that, continuing to attend support group meetings or group therapy significantly reduces the chances of relapse. Okay. In my situation, I actually found that going to support groups made it worse, because the more I talked about the use of the substance, the more I wanted the substance. So I didn't use that route. I was in the hospital and I was treated there, and I dealt with psychiatrists, as well as different ways to change what you do during the day. So hobbies, for instance, like painting. And I would say for me that group therapy doesn't work. Now, what did work is drug therapy. It's very often beneficial for people with mood disorders like these to attend congenital behavioral therapy or a similar form of therapy. The goal of CBT is to train clients towards more adaptive through patterns, teach them new behavioral skills that can strengthen impulse control and help them find healthier ways to cope with things when things get tough. For those with more severe mental illness that have psychosis as common symptom, there are a number of antipsychotic medications that can be used, and these individuals are often also part of antidepressant or anti-anxiety medications. Just like With the other disorder, it often takes some time to find the right drug combination of drugs to make symptoms manageable. For people with schizophrenia, group therapy with others dealing with schizophrenia is more beneficial than individual therapy due to the support they find in those who can truly empathize with them. This can help them stay on track with medication, which is very important due to the fact that only 25% of people with chronic mental conditions report full adherence to their drug treatment during a 12-month period. Family therapy can also be essential, as high stress can trigger psychotic episodes and the urge to self-medicate. In spite of common stereotypes, people with schizophrenia can live normal lives with medication. They might still have occasional minor hallucinations, but they are able to recognize that they are not real, avoiding psychosis. So I was put on a drug regimen. One of the drugs I was put on was called Atroxin, which is a drug that helps block the opiate receptors in the brain so that you don't desire alcohol. The other one was Olazapine, which is to help with it is an antipsychotic. I believe it's an antipsychotic. And that was coupled with a drug called Invega, which is an injection that you get. And it starts off and you can get the injection once a month. And after 6 months of consecutive use, the doctors can change that to every 3 months. And I do believe they're working on a 1 year or 6 month rather injection, but I don't know if we have that in Canada or even if that exists yet. So I wouldn't say that that does, but they do have a 3-month injection. So instead of forgetting to take your meds or getting off track, I found the injection to be helpful because I take the injection and I started off on a 1-month injection. So now it's a 3-month injection. And the 1-month injection, I was on that for 6 months before I switched to the 3-month. And so now I've had 2 needles of the 3-month injection. And I find it easier to function and I find it easier to concentrate. And it doesn't affect my life in the way it did previous to that, where I had to be hospitalized. So hopefully you find this helpful. I suppose I could have looked up a Canadian article, but Americans' research is just as valid as Canada's research. And if you want a Canadian site that talks about psychosis, you can go to CAMH, CAMH, and they also have a review of psychosis and different disorders. Actually, it goes into great detail. Signs and symptoms. Psychosis affects the way a person thinks, feels, and behaves. The experience of psychosis varies greatly from person to person. Psychosis can come on suddenly or can develop very gradually. So, positive symptoms are those that add to or distort the person's normal function. They include delusions, false beliefs that are firmly held and are out of keeping with the person's culture. Hallucination, hearing, seeing, tasting, smelling, or seeing or feeling something that is not actually there. Disorganized speech, thought, or behavior. Switching rapidly between subjects in speaking, finding it hard to concentrate, or following conversation, being unable to complete everyday tasks. So those symptoms that I had have actually been resolved. So I do like CamAge's site, so I'm going to add CamAge to the. I'm going to add it to my live stream. If you'd like to learn more about mental illness, there is a Dr. Jerry T. Wise that is very good. Or you can try Googling the particular mental illness that you're dealing with. I also randomly do videos. It's not always about mental health, but this time it was. So you might check to see if I've done a video. But if you're looking for something more structured, certainly looking on the internet in your area, typing in the type of mental illness that you're describing, and then treatments for that and treatment options in your area. Because the reason I didn't read the treatment options for America is because I'm not going to fly to America to get treated. Also, I can't afford there. As I said, in Canada, we do have a problem with people getting treated due to the fact that there's a lack of accessibility to healthcare, especially mental health care. And the reason for this is basically financial and not having enough doctors in certain areas. So in the royal communities, we suffer from the problem of not having enough doctors or not having enough programs to begin with. Hopefully, as we do videos and update the government, maybe the government will listen to the people and be like, and do something more positive to deal with patients so that they don't have to get to the point where they have a psychotic break to get treatment. It should not be that to get treatment, you first have to hurt somebody or yourself. That should not be. And so my name is Cerise, and that's all I have to say on psychosis and drug-induced psychosis. Thank you for watching. Hit the like button if you like.